If we examine the role that digitalization and technology implementation has played so far in healthcare, we would see that it was largely used to replace analog processes with digitized processes. Yeah, so note taking has shifted from a doctor's notepad into a computer screen. Yeah? However, even before COVID-19 pandemic, we have been, as global economy, spending $7 trillion on healthcare. And out of that, only 1% is spent today in technology implementation of tools and technologies which make processes more efficient, more automated than before. And when you benchmark this with other industries, clearly healthcare is way behind in leveraging technology to make the process more efficient, agile, and less labor intensive. And if you think of the major trends which are impacting the quality of healthcare being provided today globally, we see that shortage of skilled resources, not only technicians, but also physicians and specialists, is a big issue. Also, we have a more chronically ill patient population, which is demanding more care, but not all that care can be provided within the hospital because it becomes just too expensive. Also, the chronically ill patients require continuous monitoring, which is again not possible to be done with the resources that we have typically inside the healthcare system. So, all these things require healthcare to leverage technology more and more. Technologies like virtual consultation can help bridge the gap of between the episodes of care much more smoothly. Robotic assisted procedures can improve access to high quality interventions because the specialists can do remote procedures and thereby providing care at even satellite and rural locations. Similarly, remote monitoring can provide a continuous touch between caregivers, and sometimes it doesn't have to be specialists or physicians, but even nurses, to monitor patients before and even after an episode, a clinical episode, to make sure they are returning to health in a good way. Similarly, AI can really help make the triaging process, which takes a lot of time of specialists and physicians, make it much more automated and thereby helping them to take that time away from their computer screens and taking notes to focusing on being in touch with the patient, understanding and being more emphatic about the pain and the issues that the patients are facing. Having said that, technology alone cannot cure all the ills of the current healthcare system. In fact, I do believe that this also requires a new leadership thinking, where in the healthcare leaders to create a much more agile, more integrated, and more patient centered healthcare system, where technology is a means to an end, and that end is better physician and patient satisfaction. I repeat, better physician and patient satisfaction, because when these two, the caregivers as well as patients, are satisfied with what they are giving and what they are receiving, I think we can have really optimally working healthcare systems in the world. At the same time, we need to be clear that this human aspect of care is irreplaceable by technology, and technology only works together to support that the human aspect can be focused on the interactions with patients at the point where it matters most, and the doctors are and nurses are able to take their time away from the tedious, sometimes mundane, manual, and repetitive tasks, and really focus on interacting with patients and providing that emphatic care.